Hi, this is Chip Means with Healthcare IT News. I'm here at the BlackBerry booth at HIMSS11, and Fraser's going to tell me about what BlackBerry is announcing this year at the show.
Thank you very much. So really, HIMSS is about two things for us this year. It's about continuing the conversation around how the smartphones are making headway into the medical space. I think everybody understands how a physician is probably using this device for access to information, for medical reference, and these kind of solutions. But increasingly, they're starting to use pager applications like AMCOM, or nurses are starting to use solutions like the Vocera badge solution and bring it onto the device. So the smartphone really becomes the device by which we're having clinical collaboration. What's also exciting is when you need the other device. And so a lot of physicians are trying to see how the new tablet devices are playing out in the healthcare context. So this is the new BlackBerry Playbook that will be out in the market quite soon. It's a very small, thin, 7-inch tablet. Yeah, it's less than half an inch in thin, I suppose. It's less than a pound in weight. And I think the first thing you really need to see about the device is how powerful it is. We're running a whole bunch of different applications simultaneously in the background. It could be taking advantage of the camera, and it could be video conferencing on the device. If I score out from the bezel, I can then move into other pieces. I might be needing to go in and pull up some video content, and I can go in and play those. I can start playing the video, but in the background I can jump into different applications. But I think more than anything, what people are going to start using these devices for is really access into health information, access into the electronic health records, or getting into some of the images. So here's an application by a company called eUnity, the company called Client Outlook, and the application called eUnity. And so this is PACS and other images. I'm able to pull the information right from the server and drop them down into the device. I'm able to then go in and start to zoom in and out on the images. So this isn't quite diagnostic quality, but in terms of the information that I'm wanting to share with the patient on the bedside, pull it out of my lab coat, have the conversation with them. This is what we found, this is what we need to do, and really start having that dialogue with them. The initial offering is going to be a Wi-Fi device that can tether to my BlackBerry, so it can take advantage of the 3G modem on my BlackBerry and when you need it. But most of the time, I'm in the organization. We've also announced various 4G versions of the device that will be out later in the year. Sprint specifically has been announced as the first carrier in terms of the 4G version. So really, what do people need? If you need the 4G radio, that's something you get. If you want just a Wi-Fi device to get started, then this can pair to the BlackBerry, take advantage of that data plan. As you mentioned, yes, it's got a 1 GHz dual core processor. It's the new BlackBerry tablet OS that takes advantage of QNX, which is the people writing the OS. So it's very powerful, mission critical, running all the apps in the background. The device has got two cameras on. We've got the 5 megapixel camera on one side, then we've got the 3 megapixel camera on the front, so you can set it up for full video conferencing, etc., telehealth. We've got 4 buttons, very simply. We've got power, we've got play and volume buttons for the multimedia functionality.
Is that a headphone jack there?
Headphone jack in the corner. And then flipper around to the other side. Basically, you've got the charging ports, you've got HDMI video, so you can pull out full 1080p high definition video, and then you've got micro SD to load content, etc.